This is an NBC News special report.
Blair Fairchild with NBC News, coming to you today live with new information about COVID-19 and possible vaccinations for the virus. According to the article, FDA approves first test to determine if a person has coronavirus, written by Amanda Woods and published on April 2nd, 2020. The FDA sanctioned a blood test that can determine whether or not the test subject has previously been infected with the coronavirus. The test works by taking blood from a patient and then studying the blood to see if there are any present antibodies. If antibodies are present, it would show that the person has had the virus at some time but is currently not infected, as the body has built up a tolerance to the virus. According to the text, a fascinating fact about antibodies is that they take a while to develop, which is why if a person has the virus or has had it very recently, the test will not detect any antibodies, therefore counting them as a negative case for the virus. It has been said that the test is not 100% accurate because it only identifies past cases, but according to the FDA Chief Scientist Denise Hinton, the known and potential benefits of your product when used for diagnosing COVID-19 outweigh the known and potential risks of your product. The risks mentioned by Denise Hinton are not getting an accurate count of cases, as only previously infected patients test positive. But this serology test can help determine how prevalent COVID-19 is, and any test is better than no test. To further on this subject, from the article, Researchers Able to Test If Coronavirus Survivors' Plasma Can Protect Health Workers, written by Vincent Barone and released on April 3rd, 2020, scientists at Johns Hopkins University now have official federal approval to test blood plasma from recovered COVID-19 patients. The goal of the test is to take plasma containing antibodies from a survivor of the virus and transfer the plasma into people currently infected or into frontline workers who are at high risk for the virus. The plasma would mix with the person who has not yet been infected and release antibodies into their systems, hopefully creating an immunity, or to strengthen the immune systems of those currently infected with the virus. According to Johns Hopkins, Cassadevall has amassed a team of physicians and scientists from around the country who are now establishing a network of hospitals and blood banks that can collect, isolate, and process blood plasma from COVID-19 survivors. Interestingly, from the text, blood plasma transfusions are a common practice for patients of severe bleeding, but they are being transformed during this time of adversity into a hopeful preventative to help stop a global pandemic. Additionally, from the article, a second potential coronavirus vaccine is entering human testing, published on April 7th, 2020, by Zachary Kaiser. A vaccine designed to treat humans for coronavirus has recently been approved by the FDA to enter experimental stages. The vaccination has been used on animals with good results, so the human version of it has been categorized as an investigational new drug. The vaccine will go under a testing period to prove its effectiveness by being administered on 40 adult volunteers. Each volunteer will receive 2 rounds of the vaccine to determine safety, immune response, and efficiency at treating COVID-19. The company behind all of this, Envio, hopes to get the vaccination into worldwide circulation, and according to TechCrunch, depending on the success of their clinical trials, the pharmaceutical company could have 1 million doses available by December. Although, from the text, official approval for the test would take anywhere from a year to a year and a half, even if the test proves itself essential for the coronavirus. Once again, I'm Blair Fairchild with NBC News, coming to you today with updates concerning COVID-19 and reminding you to stay in, stay safe, and wear those masks.
This is an NBC News special report.